Hi, I'm Martina Tierney, Occupational Therapist and Clinical Director at Seating Matters. We have completed a clinical field trial at St Camillus Hospital in Limerick. The aim of the field trial was to evaluate the effectiveness of specialised seating in terms of the client's functional ability, their time spent in bed, their pressure management needs, their risk of falls and the moving and handling of the clients. The results were significant and involved the cooperation and commitment of the management, the staff and the patients.
So when we first started, we had about 20 residents that actually were full-time in bed, and as a result of this now we actually have no resident left in the hospital in bed. Every resident is actually given the opportunity and is benefiting from coming out of their bed and sitting out every day. And then they actually can engage with other people. They can actually leave their room. They can choose to engage in activities, and for many residents it's the first time they may actually get to eat outside of their bed for many years, so it's huge.
It is a new initiative, it's a new project. Not only does it bring forward new, seating arrangements for residents, but it also encourages project management from a staff perspective. If we can reduce the number of pressure sores that a resident is going to get through projects like this, it's the saving, financially definitely, but from a personal perspective, a psychological perspective, it's going to be a whole lot better for everybody.
Passports were introduced to reinforce our training. We can't be on the wards at all times, but for some of the wards there's a high turnover between agency staff and relief staff and that, so CNMs are asked to advise or direct the newer members of staff to the seating passports in the mornings before any kind of handling or management of them, and a step-by-step kind of, as best we can, how the chair operates or what works for the particular individual involved.
From a day-to-day perspective and activities daily living with the patients, they seem to be very happy in them. We've no pressure ulcer issues. They're eating, they're drinking, they're doing what they can do, as well as they can.
We have 27 residents on the chairs and we have one with a pressure ulcer.
He has 3 pressure ulcers, his back and his 2 hips presently, so we took him in on respite there back in May, and he was in with us for about 3.5 weeks. Within that 3.5 weeks he prefers sitting out. He finds it less painful sitting out in the Sorrento tilting space chair. We managed to heal the left hip substantially well. It was gone down to maybe a grade 1 pressure area.
Not only were there clinical benefits, but the financial savings were also significant.
The benefit financially and emotionally for the service user is huge. There's less time required even for the care of the patient because they can actually come out of their room and engage in other parts of the facility. It means that actually less time is required for their care. It isn't just about assessment and prescription, it's actually about assessing prescription, follow-up and review, and also upskilling and training of the nursing staff, the multi-class attendants in actually supporting them and actually achieving and maintaining service users in a good position.